Welcome to Metabolic Syndrome Explained. From the experts. A video from the NASH Facts project, an organization committed to bringing you expert information from trusted sources about fatty liver disease and NASH. Enjoy the quick guide to metabolic syndrome, based on expert health information from the National Library of Medicine. Metabolic syndrome is also called insulin resistance syndrome and metabolic syndrome X. What is metabolic syndrome? Metabolic syndrome is the name for a group of risk factors for heart disease, diabetes, and other health problems. You can have just one risk factor, but people often have several of them together. When you have at least 3 of them, it is called metabolic syndrome. These risk factors include 1. A large waistline, also called abdominal obesity, or having an apple shape. Too much fat around the stomach is a greater risk factor for heart disease than too much fat in other parts of the body. 2. Having a high triglyceride level. Triglycerides are a type of fat found in the blood. 3. Having a low HDL cholesterol level. HDL is sometimes called the good cholesterol, because it helps remove cholesterol from your arteries. 4. Having high blood pressure. If your blood pressure stays high over time, it can damage your heart and lead to other health problems. And 5. Having a high fasting blood sugar. Mildly high blood sugar may be an early sign of diabetes. The more factors you have, the higher your risk for heart disease, diabetes, and stroke is. What causes metabolic syndrome? Metabolic syndrome has several causes that act together: overweight and obesity, an inactive lifestyle, insulin resistance, a condition in which the body can't use insulin properly. Insulin is a hormone that helps move blood sugar into your cells to give them energy. Insulin resistance can lead to high blood sugar levels. Age. Your risk goes up as you get older. Genetics, ethnicity, and family history. People who have metabolic syndrome often also have excessive blood clotting and inflammation throughout the body. Researchers don't know whether these conditions cause metabolic syndrome or worsen it. Who is at risk for metabolic syndrome? The most important risk factors for metabolic syndrome are abdominal obesity, also known as a large waistline, and an active lifestyle, and insulin resistance. There are certain groups of people who have an increased risk of metabolic syndrome. Some racial and ethnic groups. Mexican Americans have the highest rate of metabolic syndrome, followed by whites and blacks. Also, people who have diabetes, and people who have a sibling or parent who has diabetes. In addition, women with polycystic ovary syndrome, or PCOS. And, finally, people who take medicines that cause weight gain, or changes in blood pressure, blood cholesterol, and blood sugar levels. What are the symptoms of metabolic syndrome? Most of the metabolic risk factors have no obvious signs or symptoms, except for a large waistline. How is metabolic syndrome diagnosed? Your healthcare provider will diagnose metabolic syndrome based on the results of a physical exam and blood tests. You must have at least 3 of the risk factors to be diagnosed with metabolic syndrome. 1. A large waistline, which means a waist measurement of 35 inches or more for women, 40 inches or more for men. 2. A high triglyceride level, which is 150 mg per deciliter or higher. 3. A low HDL cholesterol level, which is less than 50 mg per deciliter for women, and less than 40 mg per deciliter for men. 4. High blood pressure, which is a reading of 130/85 mm of mercury or higher. And 5. A high fasting blood sugar, which is 100 mg per deciliter or higher. What are the treatments? For metabolic syndrome, the most important treatment for metabolic syndrome is a heart-healthy lifestyle, which includes a heart-healthy eating plan, which limits the amount of saturated and trans fats that you eat. It encourages you to choose a variety of nutritious foods, including fruits, vegetables, whole grains, and lean meats. Also, aiming for a healthy weight, and managing stress, plus getting regular physical activity, and, finally, quitting smoking, or not starting if you don't already smoke. If making lifestyle changes is not enough, you may need to take medicines. For example, you may need medicines to lower cholesterol or blood pressure. Can metabolic syndrome be prevented? The best way to prevent metabolic syndrome is through the heart-healthy lifestyle changes. The NASH Facts Project would like to thank Medline Plus from the National Library of Medicine. Medline Plus brings together authoritative health information from the National Library of Medicine, the National Institutes of Health and other government agencies, and health-related organizations. We would also like to thank the NIH, National Heart, Lung, and Blood Institute, or NHLBI. The NHLBI is part of the U.S. Department of Health and Human Services, National Institutes of Health, the nation's biomedical research agency, that makes important scientific discoveries to improve health and save lives. This was metabolic syndrome, explained from the experts. Thank you for watching. Be sure to like this video and subscribe to our channel for more high quality, thoroughly researched, and medically reviewed content from trusted sources. And check us out on social